Good afternoon and welcome to our first St Vincent's in Conversation series for our corporate partners. For those of you I don't know or haven't met, my name is Shanthini Naidu and I'm the CEO of the St Vincent's Curran Foundation. Thank you to you all for joining us, and we can see some of you online already but don't have video for everyone. In this new age of Zoom and Teams, may I ask that all of our little mini events turn your mics on mute or use your chat box to send us questions and comments. There will be time for all of you to participate and ask questions a little later on. And also, I do hope you know where your fire exits and bathrooms are, because I can't help you there today. I would like to begin by acknowledging the traditional landowners upon which St Vincent's Hospital at Darlinghurst is located on, the Gadigal people of the Eora Nation, and pay my respects to elders past and present. This week also happens to be 150 years since St Vincent's Hospital moved to Darlinghurst from Potts Point. And so I would like to acknowledge the visionary founders of St Vincent's Hospitals, the Sisters of Charity, who continue to inspire us and guide us today. They started services for mental health at the very beginning of St Vincent's Hospital. So it's wonderful to see so many new faces and also familiar faces joining us today, representing so many different industries, from insurance to rice growing to property development, clothing manufacturing, and even fluid transfer solutions. I know you all have different reasons for your connections to St Vincent's Hospital and the St Vincent's Curran Foundation, but you all also have one wonderful thing in common, and that is all you have done and do to continue to support St Vincent's Hospitals. So joining us today, we have, I believe, I think I can see GSA online, certainly Sunrise, that's Sandra, is it?
Yes.
I can't quite, it's hard to see on the screen the names, so excuse me if I get your names wrong, but I think it is Sandra from Sunrise, and Sunrise are wonderful supporters of our hospital in Griffith, in the St Vincent's Private Community Hospital, and helped us to establish that hospital there. The BHL group, so I think Sharon Park and the team from BHL, Pertec, and I believe Mark Devitt from Pertec is joining us, and Tim Riddell. Thanks, Tim. I can see you online from All Shelter. All Shelter have been wonderful in supporting us through our COVID-19 response through the supply of marquees. We have Carla Gita, I hope I've said that right, and possibly Melanie Levis from the Q Clothing Company, who were incredible in March and April, pivoting to make scrubs for our nurses across our public and private hospital. Also online, we have from our team, our corporate partnerships team, Jennifer Dobbins, the famous Jane Ferguson, and Ashley Richardson. So today we are recognising Mental Health Month. And I think we all know in the discussion in the media and all around us how serious the issue of mental health has been for many years, and through this COVID-19 pandemic and previously the bushfires, it has become even more of an important issue. The impact of mental health, with 1 in 2 Australians having some kind of mental issue or illness, but only 50% will seek treatment, which can lead to serious consequences. The National Mental Health Commission has a lot of figures on the impact economically of and the cost of mental health in Australia for our businesses and for our community. But of course, as we know, mental health can cost much more than money. It costs lives. And at St Vincent's, we're really taking an integrated approach to trying to deal with those issues, which Mike Millard, who's the director of our This Way Up and Centre for Research into Anxiety and Depression, will be telling you more about today. We've also joined by our wonderful friend and supporter, and in fact our newest corporate partner, Matthew Duncan. Matthew's family has been associated with St Vincent's Curran Foundation for almost 30 years. So Matthew was just a child when he started supporting us. And Matthew's going to talk about his new business venture, ADA Australia, which is Alcohol Drug Awareness Australia, and how the work they are doing to support industries, companies and communities with dealing with issues associated with mental health and alcoholism and drug abuse. And now I'll hand over to Ashley Richardson, who's going to facilitate the discussion on behalf of our corporate partnerships team.
Thank you so much, Anthony. And I'd just like to echo your welcome to everyone here today. It's really exciting to have this big screen of you all in front of me. I encourage you all to turn your cameras on as well, and we can try to feel like we're in the same room together, almost. So I'm really excited to be with you all here today, and yeah, I guess we'll jump right in. So I see some more cameras turning on now. That's great. So Mike, I think we'll start with you. We've all been hearing a lot about the impact of COVID-19. So it's a phrase that we hear in the media quite a lot, and it has different meanings for everyone. We've had lots of changes in our day-to-day lives, some negative, some positive. I think we all have that colleague who can't quite master the mute button. Some very amusing. But can you discuss some of the psychological impacts of what we've been through, particularly in terms of isolation and how that's affecting us?
Yeah, absolutely. Look, I think the first thing that I really have to say is that in what's going on, we're all participants, that actually none of us are just observing what's going on. And I have to say that there's not an area of our lives that COVID hasn't impacted.
Yeah.
And I think coming out of that has been a whole range of emotions. So there's been sadness, there's been grief, there's been overwhelm, there's been anger. And fundamentally, I have to say that all of these emotional responses have been normal. And one that I'd particularly like to mention is, of course, the anxiety that I think that people are experiencing across the community. And it's really that toxic dynamic between the amount of uncertainty that we've all been experiencing and the sort of unprecedented change that we've all been experiencing. Now, whenever I talk about anxiety, I always make the point in saying that a little bit of anxiety is actually something that's helpful. So it's normal to be experiencing anxiety at the moment. To have no anxiety means that we're not taking the precautions that are necessary to keep ourselves safe. But also for a significant proportion of the population, people are also experiencing overwhelming anxiety. Now, to throw on top of this, we're told that in order to keep ourselves physically safe, we have to keep ourselves psychologically distanced. And this terrible phrase of social distancing has come about rather than physical distancing. And alongside that, we also recognise that that increased isolation leads to increased levels of anxiety, increased levels of depression, increased levels of anger, and of course what we're seeing is increased domestic violence. So I think that we throw into that the physical effects that come from that, and they're things like poor sleep, chronic inflammation, and this pervasive sense of fatigue that we're seeing across the community.
Yeah, absolutely. And there's I'm sure we can all relate to that feeling of sort of underlying anxiety, and definitely enhanced by potentially working away from your team who you may have worked very close with in the past. So it's actually comforting to hear from a professional, one who specialises in anxiety disorders, that some level of that is actually quite normal.
And protective.
Absolutely, fantastic, thank you. So further to that question, because this is a corporate partnerships event, a lot of companies have had the very difficult task of having to let people go, creating redundancies, and some of their employees may have been with them for 10, 20 years. Qantas and the airlines are obviously the most famous example of that. I can imagine that this would be an incredibly difficult task, not just for the employees, but also the employer. Can you maybe discuss some of the impacts on that and maybe some coping mechanisms for how people can deal with that kind of stress?
Yeah, absolutely. I think I start by saying that decision making is difficult at the best of times. And then again to throw in, as I've said, the unprecedented change that we've all been experiencing. I think the first thing that I would say that it's very important for us all just to take a breath and really to pause, to be able to stand back and take stock of what is happening.
All together now.
Then the next thing really that comes to my mind, and it's certainly been a concept that's been around healthcare, is this idea of moral injury. And what that refers to, and it's thankfully not something that we've particularly had to confront here in Australia, but what we've seen overseas is that the healthcare systems are having to make decisions about who gets treatment and who doesn't.
Yeah, wow.
And what we're seeing from that is that these decisions, and it's very similar to the decisions that people are having to make about workplaces, is that it comes at an immense personal cost. Because the heart, of course, sits with people, but we also recognise that there's also a responsibility to the organisation when people are looking at making these difficult decisions. From that, of course, we see common emotional responses again around sadness, guilt, and also I thought I would also raise the idea of survivor guilt. I think that the first time that this year that this really came up for me was that I was sent down as part of the emergency response to the south coast of the bushfires, and what we were seeing was that there'd be streets of houses that were all destroyed, but there'd be one that was left standing.
Wow.
And what was coming across were a whole lot of questions about, why is it me that was spared from this? And I think that for us, for people who are making decisions, there's also decisions like the ones that we're talking about. There's also a part of us that says that, I have 3 children, yet, the person that I'm having to let go also has 3 children, and there's a humanness in that connection that's also worth recognising. I guess that throws up the importance of maintaining our ethics and values when trying to work through these sorts of decisions. And I think that I'd be encouraging people to really focus on maintaining an ethical process in making these decisions and focus on the ethics of the process rather than necessarily the outcomes that are happening. The other thing that I have to say is it's extremely important to remain compassionate. And I start by saying remain compassionate to ourselves when we're having to make what are very difficult decisions, but also compassionate to the staff that are being let go, or the staff that are certainly remaining behind. Part of that, I think, is trying to be as collaborative as possible, so involving as many stakeholders as possible in terms of shareholders, customers and staff within this decision-making process. Try to be as transparent as possible. I know a lot of organisations are looking to their boards for ethical and value-based decisions around this, and I think that that's a really positive way of tapping into that governance structure that exists within corporations. And the last thing that I'd probably say is that I think it's important for people to be able to find for themselves somewhere that they're able to vent. And I think that might be a colleague that's outside of the organisation who's close to you, that can also help you to be able to sit with that, your own sense of, I guess, uncertainty and your own way, help you to be able to process what's happening.
Thank you so much for that insight. I know that will be very valuable to a lot of people watching. Even if we're all lucky enough to be with our companies now, I'm sure that we have friends who have been in this position, so perhaps that's some insight we can share with them. So at this point, I think I'd like to reintroduce Matthew into the conversation. Matthew, you have been very open about your personal journey towards wellness and sobriety, and I know that you've inspired a lot of people with your journey and what led you to ADA Australia. Would you mind sharing a bit of that now with us?
Absolutely. Thanks, Ashley. Hi, I'm Matt. Look, I think it was interesting just listening, the word isolation at the moment, it's the first question today, it's in there, it's talked about often. And one of the things I've learned in the last couple of years is the opposite of isolation is connection. And I think in terms of my mental health, and I mainly talk about me, in terms of my mental health, any lack of connection leads me into a place of isolation. I can be in a room full of people, and if I'm not connecting, I'm isolating myself from them. And I think that's something which I had to take stock of and really get to understand that. Look at this setup today. We've got people in front of us and we're hiding behind screens because that's the world we live in today. And I look at the digital world. I'm involved in other businesses in software and digital, but it's such a valuable tool, but it needs to supplement the connection that people require. Yep. It shouldn't be the tool that we only use.
It's a very good reminder.
In terms of my story, I'll try and go through it very briefly because I could probably take the full hour and still not get through it. But it's a privilege to sit here today because this time 3 or so years ago, I wouldn't have been in any capacity to get in front of anyone, let alone sit inside the hospital in a room like this. I probably would have been in the hospital in the emergency department. But my story briefly was, as a child, I was raised in a loving family. I've got 2 parents who are still together 40 years on. I got a loving family, a sister. I went to a good school. I went to university. I started in a professional career. I worked in a big family business for a long time. Growing up, I really didn't want for very much at all. So on paper, you would say that, I had the perfect life and, who wouldn't want that life? But I think underneath, there were underlying issues, which I, first of all, had no idea about, and second of all, didn't know how to address. And throughout my university and working life, there was alcohol involved, but more in a social setting for a long, long time. And it really wasn't until probably 6 or 7 years ago that people around me started to notice the changes in my behaviour and simple things like erraticness, not turning up to certain events, not being punctual, and little other signs came through. At this stage, I was fairly, pretty much in denial about all of these things and really couldn't see what others could see. I think I put it down predominantly to that's just what I enjoyed doing. Socialising and drinking and dining and entertaining was part of my job. And over time, that became less about the job and less about the weekend. And eventually, the weekends became the weeks, and then they all sort of blurred into one. So I got to a stage where I was running a large business effectively as a functioning alcoholic, and the only person who couldn't see that really was me. And I think you give yourself a sense of validation that even though you know this is happening to you, you're still getting the results on the board. Mm-hmm. You're hitting the budgets and you've got good staff and they want to be with you. So you can't see why your behaviour isn't correct. And then I think in terms of any style of addiction, eventually the progressiveness of it takes over, and the progressiveness really, for me, compounded at a time where I was going through a divorce, the sale of a business, and I really entered a bit of an identity crisis. I was so tied up in the identity of who I was, as in what my position was in the company I was in, and I really didn't know who I was. And look, my story got worse before it got better, and I won't go into all the details of that, but I'm not ashamed of it, but you guys just don't have time with it today. But in terms of that, I really had to take stock of my life. I had, a number of callings that most people would have considered, I think the term a lot of people use is rock bottom, but I was getting prepared to dig through that. And, eventually I got to a stage where I knew my life was unmanageable and I just couldn't keep going on with it. Yeah. I had to seek treat through rehabilitation centres, and I eventually went through legal proceedings for DUIs, and I had a number of incidences which I'm certainly not proud of, and I certainly hold myself accountable for. I just have a better understanding today that I have a disease. It's a disease of addiction, and the substance that I chose was alcohol. So about 2 years and 3 odd months ago, a couple of weeks, I had my last drink, and I haven't drunk since. I've been sober since. There's certain things I put into my life to assist me to do that, and it was, my life has turned around from that. It's probably been, it has been the best decision I've ever made in my life. And when I reflect upon it, it wasn't the decision. Making the decision was hard. But it wasn't really about the decision, just really about the change in attitude and behaviour, and really a lot of acceptance around who I was and what I wanted to do. So that's the quickest I can tell you that story.
That's a fantastic achievement. And
thank you.
I'm sure everyone's applauding you on their mute buttons. I see Jane applauding you there. Everyone's applauding you here. And so Alcohol and Drug Awareness Australia, obviously that's something you found after you became sober or decided to quit alcohol. Can you talk to us a little bit about what it means? What does alcohol and drug awareness mean, and why is it important to have awareness around that during a pandemic?
Absolutely. It's actually a business that I was invited to become part of before I got sober. And I think at the time, at some subconscious level, I knew that this was something that I had to do. In terms of the business, it was a business that started about 5 years ago. It was started by 2 gentlemen who are good friends of mine. They actually helped me to, find a better way to live, and I'm very grateful for that. And where it started was both of my business partners also have their own stories of recovery and living in sobriety, and they initially went into the rehabilitation space. What they saw was this was right down the bottom of the funnel where people's lives have become very critical. And it was a hard area to help people, and you only got to a very limited or finite number of people. And a lot of people never make it there. So they decided, and not long after I joined with the guys, that we'd focus up the top of the funnel, and that was around education, that was around awareness. The approach we took was that if we were able to empower people with more education, more awareness, which gave them better opportunities to make the right decisions and gave them choice, then maybe we could stop the people who could get down to the bottom of the funnel. And so most of the clients that we deal with are private businesses, corporate sector, a lot with unions as well. We don't go in there telling people what they should or should not do. We just go in there to give them the education and pass on what we've learned over the years, and allow them to make the better decisions. The business, 90% of the staff in the business are also living sober, and 100% of our facilitators the same. So when we pass on the message, which this year has changed quite a lot in terms of webinars and Zoom as opposed to face-to-face, the message is given from a position of lived experience. And I think that's quite powerful when you can talk to the knowledge and you can add in your own experience. I think that gives a connection that people can relate to.
Absolutely. And I'm sure I can see Mike nodding here. One of the most powerful tools we have as people is story. So sharing story and relating to that, and as you said, finding connection is an incredibly healing power. So congratulations again on the company. It's particularly relevant, I think, with the statistics about increase in alcohol consumption. So something for everyone to be aware of. So Mike, we'll just come back to you. And for the parents on the call, I would like to talk about how the pandemic has impacted young people. So adolescence, obviously a time of great change, physically, socially, academically, and we also know that the majority of mental health issues arise during adolescence. Can you talk about some of the impacts this may have had on people's kids, and maybe a good way to start having conversations with them about mental health?
Sure. So I would say thank you for sharing your story.
Absolutely.
But we have seen significant increases in adolescent distress across the community. And I think that they're experiencing a lot of the same things that we are. So the flashpoints are really around having to work from home, homeschooling, and obviously social isolation from their peers. Now, I want to throw into the mix that there's 3 significant differences. Now, the first significant difference is that for the adolescents, the part of their brain, the frontal lobe that teaches us about, that does our forward planning and our decision making and the higher functions, hasn't formed. So this doesn't set until you're in your 20s, and for boys it's up to 25.
35.
So there's differences in our sort of our cognitive abilities that we have. I also would say that adolescents for many adolescents haven't had the life experience of difficult experiences that they're able to draw on to really have that fundamental idea that despite what's going on at the moment, it will be okay. And then, of course, lastly, we know that adolescence is this immensely turbulent time for most of us, which is usually characterised by a lot of difficulty in what we call distress tolerance. And that's where we see a lot of kind of the sort of maladaptive sort of coping skills in managing distress that we're seeing a significant increase in across the community. So I think that what I would say about talking to adolescents is they know what's happening. And I'd have to say that it's very important for us really just to start with listening. And part of listening is then really to help adolescents to be able to name and to experience the emotions that they're experiencing. Part of that is also to validate that that we're all having individual experiences of what this pandemic means for us. So being able to listen, being able to validate the individual experience, and also to be able to listen without judging. I was talking to a colleague, and they were talking about how they'd spoken to someone, and they were saying that their adolescent was particularly distressed about the restrictions around dancing at formals.
Yeah, of course.
And really, it's got to be in the context that whilst for some we might think that this might not be a significant thing, these are important events and markers for that we experience in our adolescence, and adolescents experience them within that context. So that's where validation and having a non-judgmental approach, often just allowing the space to be able to sit with these emotions and experiences, is also very important. And then finally, to be able to say that really acknowledge what adolescents are experiencing, and to be able to have the idea that they'll be able to move beyond this is really the key.
Look, I found that comforting. So, hopefully that has given some value to the parents in the room. Matthew, I know you're a parent and an uncle. Given your experience having difficult conversations with people about challenging subjects, is there anything you'd like to add about how you might begin to have this kind of conversation, particularly around alcohol, with adolescent children?
It's interesting. I was just listening to Dr. Millard, and I agree totally about exactly what he said. I probably just said it in different words. That ability to create that safe space, a space where one feels that they're heard. How many times do we listen to somebody but you don't actually hear them? And I think if you want to encourage someone to be open and honest in a conversation, then number one, you've got to be open and honest yourself. And, I found that when I share my story, someone will share their story.
Yeah.
And maybe one day my girls will watch this and they'll know that I use them as guinea pigs sometimes. But when I share a story with my daughters about something that I have done either as a child and share it in the appropriate way, it changes the dynamic of how they share.
Yeah.
When I change the language around not asking a closed question that you can answer yes or no, and it has to be an open-ended question, then they have to give an answer. So I think it's really about creating that safe space. I think if it's an important enough conversation to have, make it important. Find the space, find the time. Don't have the distractions around you. I think a few of the things that come to my mind is the openness, the open-mindedness that when somebody's, I may not agree 100% with what the answers are, but I should be open-minded enough to accept it. Doesn't mean I support it, but I can accept that is their view. I think in terms around alcohol and drugs and mental health and people's life choices, I think when talking to, my girls are younger, they're not teenagers yet, but they will be, they probably think they are. But there has to be certain boundaries that I as a person am willing to accept. But I also have to communicate those boundaries so that the people I'm setting them with actually know what they are. And if they cross them, there has to be a consequence.
Right.
Because if I'm willing to accept somebody crossing them, then that's going to show that the boundaries are not important to me. So I think it really comes down to a lot of those areas. I think nobody wakes up in the morning and says, "Great, today's a good day to talk to my kids about drugs and alcohol." But I guess the point I would put to you is, I'd rather preempt it than get to the stage that you're trying to fill in information when they've received that information from somebody else that you don't know. So I don't know when the exact right time is, but it's before somebody else.
Yeah.
For someone like me, it's going to be a more difficult conversation with my daughters because, I think addiction is something that there is a strong correlation with genetics. And there is an opportunity that 1 or 2 or 0 of my daughters will have this. So I haven't had the specific conversations about it. My daughter's already told me that she can't wait till she's 21 to drink red wine. And I asked why, and she said, because it looks cool.
Okay.
But she doesn't know much more than that.
Yeah.
But at the right time, I think I'll approach it.
Good, she's waiting till 21.
And I was just about to say that. 21.
She hasn't probably worked out the Australian laws yet.
Just watching a lot of American soap operas. I just wanted to pick up on one thing you said that I think a lot of people or parents will be able to relate to, and that is being able to ask open-ended questions. So I remember it used to drive my parents crazy when they would say, "How is school?" And you go, "Good, great." That's it, and just those one-word answers. Do you have any, as a parent, any recommendations as to what those open-ended questions might be?
Oh, I've got lots of them, and I'll be very transparent. This came not from understanding myself better. This came from car sales training 25 years ago, which is you never ask a customer an answer they can say yes or no to.
Oh, there you go.
But to just go on to your point, with my daughters, I don't ask them how their day at school was. I ask them, tell me the most interesting thing today, the thing that you liked the least, and the best feeling that you had. Like, name a feeling. And good is not a feelings word.
Right.
And it takes a little bit longer, but they'll think about it.
Yeah. Maybe we could start our whips like that, Shantini.
That could take a very long time.
Yeah. Well, thank you so much. So if we take it back to the office now, there have been a lot of stories about working from home that are negative and also positive. So there have been some silver linings to the new restrictions, despite what we've just been talking about. I think a lot of organisations are realising that flexibility around staff, locations and hours can actually empower people and increase productivity. Matthew, what has your experience been about remote working and how has this affected your day-to-day relationships within a business model?
Look, I'm a big fan of remote working prior to COVID. And it's something I've always, as a business, tried to encourage. And I know I'm going off topic a little bit,
Please.
but I love the fact that employees have the empowerment of being able to have this ability to work more remotely, flexible working hours, flexible locations. I don't see the employees as the issue or the reason to stifle this. I see the level of our management and our leaders in industry and organisations as potentially not having the skill set to be able to give these employees what they need. I think in terms of this period of time now, I think that in the businesses that I see outside of ADA and including ADA, I think this really has given some people an opportunity to shine, and I think some people have found it very, very difficult in their working life, separate to their day-to-day life. And I think that where businesses have put in plans in place alongside the technology, they've probably got the better results. Where people think you can replicate a weekly whip but do it through Zoom without anyone working out the plan to transition to Zoom, I think you're going to struggle. So I think I have personally adopted Zoom because I've had to, and where I could. I'm not a fan of having a Zoom meeting with somebody in Sydney when it would normally have been a telephone call.
Absolutely.
But I think it brings plenty of opportunities, and I think it brings plenty of challenges. You know, our Melbourne business, for example, we do a daily check-in, and all staff at all levels, from the leaders to everybody within the organisation. But one thing we do not talk about is work.
Oh, wow.
Work is not a topic of conversation, and it is purely a check-in. Now, the people in that business have developed a lot of skills over the years of how to check in and talk about feelings. But it's been quite powerful for me when I see one of my fellow directors in a situation, because the business is in Melbourne, and effectively breaking down in front of all of his staff and seeking support from them without judgment, and then the next day come back on and he's back again, and he puts it down to that ability to share. So I think it can be used. It's just how you wish to do it.
So it's finding that way for people to, I guess, vent, but not, or share their story, and then be able to move on from that effectively to go back to work and continue, you know, within the day-to-day.
I think it's an opportunity to be heard.
Yeah, oh, that's a much more eloquent way of putting it. Thank you. Michael, do you have anything to add to the positive or...
Well, I would agree with a lot of what you've said, and really emphasise the fact that it's a very different experience for everybody. So I think that we have some people who have loved working from home because they get to spend some more time with their children, and we have other people who have been working from home and get to spend some time with their children who are really struggling.
Yeah, of course.
Of course, the things like the flexibility, the general increase in productivity that I think that people have been surprised by, recognising that we've had a decade's worth of change that's happened in 6 months when we think about the speed this might have happened otherwise. From the darker side, I have certainly seen in my clinical practice, in terms of the patients that I see coming through, a lot of people who are really missing the social interaction on a very personal level that the office environment brings. I have to say that I always feel very privileged to be working in health, where I get to turn up to the hospital and I have a lot of personal interactions with people that, for me, are very stimulating. And so I recognise that for a lot of people, they are now in the situation when they don't know when they're going to be going back into the office, if they're ever going to be going back into the office. And for people who have certainly been in lockdown when they've lived alone, it's been a very different experience that people have been having. I think that I've also seen the importance of maintaining a routine and also maintaining a separation between the workspace and the life space. And I've had several patients who we've been working to reintroduce the commute, because just even having that ability to go out and have that period of time to be able to separate these two things, it's actually very powerful. And I think that we're in danger of not recognising those things, and I think that then we get into a little bit more difficulty.
Yeah, I can actually relate to the commute a lot, because I travel about an hour to work every day, and it used to be, something that tired me out, and now I look forward to it. So I get the ferry I'm lucky enough to get the ferry to work. So now I actually really look forward to having that time and the separation. So maybe we can all start to reintroduce the commute. And Matthew, you touched on your office in Victoria. We are all lucky enough to be in New South Wales at the moment, but I know a lot of us will have colleagues, friends and family who are living in Melbourne and Greater Victoria. They're still waiting to find out when they can return to some sense of normalcy, go back to commuting, seeing their family, and it can be very difficult to try and offer comfort to people who are going through something like this without it sounding like platitudes, with the best intentions. Michael, can you maybe speak to us about how we can try and comfort our friends in Melbourne right now effectively?
Well, they've been through and are going through an extraordinary experience, I guess you mentioned your colleague in Melbourne who was able to had the emotional experience at work. I've spoken to lots of my friends who have just talked about how they've had experiences where just very minor things, they've become very teary. Almost that sort of overwhelming teariness that children get.
Yeah.
And it's really the fact that what they've been experiencing is much more of a marathon rather than what they'd probably hoped was a sprint. Again, much like I was talking about before, I think that it's very important to listen and to validate and allow our friends and colleagues to be able to express what they've been experiencing. And I would add to that by saying the very human response to that is to try and fix it or take away that distress. And we actually can't at the moment. So it's really just having the space to be able to sit with our friends and our colleagues, allow them to express what they've experienced, and also to be able to, I think, help to focus on the meaning of what's been happening. And it's really that idea that we're all in this together, and through the immense sacrifices that our friends and colleagues have been making in Melbourne, they're all helping to keep us safe. So I think that often helps by providing, to be able to refocus toward the meaning of what's been going on is a helpful way of providing that comfort.
That there is a purpose to the sacrifices they've made.
Yep.
Amazing. And Matthew, you've already sort of touched on this, but what has your experience been about how this has impacted ADA with you being separated?
Yeah, look, I think I really have to take stock of just how lucky I am where I am right now in Sydney. And it's something that when you're not going through what's happening in Melbourne, you probably don't appreciate nor are grateful enough for what we really have up here. In terms of, it was interesting, I managed to get down to Melbourne in June for 3 days and literally got down and got back up again. But our business, the office has been closed since the 31st of March, and everyone's been working from home. We planned to open up again, didn't happen. So it's been circa 6.5 months that people have been working from home. And I suppose I'll just tell you one little memory I have over these Zoom calls, but one of our facilitators was on our daily check-in, and he was sitting on his bed, and it was all messy and all those kind of things. I thought, oh, that's okay, he's just checking, he's just woken up. But it wasn't until somebody mentioned later on the phone call, it's like his bed is also his desk and his chair, and his one-bedroom apartment isn't big enough for him to have the table and the chair and everything, and he was stuck there. Now, I saw it on Zoom, and the first thing I thought about, well, that's a messy bed. Yeah. So I think it really puts into perspective how fortunate we have been. In terms of what I've seen, I saw a noticeable decline in my perception of the mental health of the team, probably at about 3 weeks into this current 110 odd day, second lockdown. And I could see it through just the demeanour and the body language, the words that they said, but the words that they didn't say. And you could see that the level of engagement and the level of, just that spark you could see, it would come and go. So they were going through better days and not so good days. So I think it's been exceptionally testing. And these are people who have gone through big previous challenges to where they are now. And one of my team made a good comment, and I can vouch that this is very true, but they said, Matt, when you spent 3 months in rehab in lockdown, going through this style of restrictions, it's not too bad. And I think we've had our own training along the way. Yeah. Look, I think that, I was reminded about a documentary I saw, and they talked about the Antarctic team that were down there, and they talked about three-quarter time. And it's like you've got a 8-month expedition, you were down there working, you get through winter, summer's around the corner, you got 60 days to go, and you're like, come on. And the hardest 60 days are the last 60 days. And they said when you hit that three-quarter time, it gets tough. And they're into their second three-quarter time, and that's pretty tough. So
absolutely, yeah.
I think the best thing that the best thing that I can do for my colleagues down there is to try and, in a very empathetic way, understand what they're going through. I like what you're talking about, and just being a listening ear. Yeah. Most people don't want your opinion; they just want to be heard.
Yep.
If they want your opinion, they will ask you for it, trust me. So I just try and listen. I just try and be empathetic and be there. And personally, I'm just grateful for everything I have today, and that's the best I can do.
Thank you very much. I think we'll jump forward towards looking towards the end of the year and Christmas. I love Christmas, but I know that it can be a bit of a triggering time. So just within the last few minutes of questions before we open it up to our audience, Michael, can you talk about maybe some ways to cope with the increased consumption of alcohol in the summer months, and how people can start to deal with those underlying mental health conditions that start to come up around Christmas?
Sure. So I think that, as you've said, I think that one of the things is going to be that the holiday period for a lot of people is traditionally a happy or joyful experience, and this one is going to be different. And as you've said before, as you hinted at there, for a lot of people that's not the case generally. So I think that it's important to focus on trying to control the things that we can control, and it's really this idea of sitting in uncertainty. It's trying to remain as match fit as possible as we go through what we're experiencing, and really that's much the same as if we were travelling for some physical challenge. There are things like making sure that we look after what we're eating, making sure that we look after our sleep, making sure that we're aware of what we're, consuming in terms of some of the less helpful coping strategies that I guess Matthew's been talking about, and really emphasising that it's important just to take one day at a time, and to remember that it's very important to celebrate the small things that we can. Really, my hope is that what comes out of this is a more compassionate and kind society on the other side of what we've been experiencing.
Absolutely. That would be a wonderful silver lining. So the other part that I wanted to mention is that Matthew has very kindly donated this wonderful book to all of you, which all of you will have been delivered this morning. I'll let him introduce it, but it is the Little Blue Book of Mental Health, the COVID-19 edition. So Matthew, would you like to talk about, sorry, you're both sort of right in front of me, two M's. Would you like to talk about ADA's response to the pandemic and what led you to create this book?
Yeah. Look, I hope that you all enjoy the book. It's there's a book preceding this, which is called The Little Blue Book of Workplace Mental Health, and this was something that upon the lockdown and upon getting to this stage, our team saw a a real requirement to look at some of our underlying areas in a bit more detail, such as loneliness, anxiety, depression, isolation, and all new concepts, I think, in some ways to people who had never been in some kind of restrictions. So it's something that we put together in-house in a fairly quick manner with our own team. And it's something that we're proud to work with the Current Foundation to distribute to the partners. But look, I think the way that we put the book together, it is designed, if you wish to read it from cover to cover, we would always love to see you do that, but it's designed in a way that you can go through to the parts that really, as a quick reference to what you're after. I think it's something that a lot of our clients that we work with already, we've provided to them, and I think the book speaks for itself.
Yeah, thank you so much for donating those. It's a really generous gift, and I think it's very relevant at the moment. I think at this point it would be great to hear from some of the audience. So if I could maybe have a chat box, because I think there might be some questions that have come up in the chat box. Or if everyone would like to use the little icon of raising your hand, I'll be able to see it and ask you to unmute yourself to ask a question. Oh, we might just need a little bit of tech support here. Perhaps while we're figuring this out, Michael, you can discuss some of the responses that St Vincent's has had to the pandemic in terms of mental health.
Absolutely.
And some of the resources available.
Look, I can just really build on what Matt said, because I think it's really important to get the conversation started, and much the same way that we're having our temperature checked every time that we walk into a hospital or a gym, I think it's important for us all to almost do a psychological check in terms of just checking in where people are in terms of what they're experiencing and where they're at. And I think part of that is to start to build into organisations the psychoeducation. And it may be starting with the idea of burnout and increased stress and distress, and then it may lead on to discussions about what really to do next. One of the things at St Vincent's that we recognised very quickly at the beginning of the pandemic was that access to services was a problem. So I'm privileged enough to be working it this way up at St Vincent's Hospital, and we're an online service. So we've been around for now just over 10 years in our current format. And we specialise in taking what we would usually do on a face-to-face basis and to take that treatment and to translate that into an online format. We offer, I think there's 18 different courses. The courses are all evidence-based, so that when we say something works, we know it does. Each of the courses have been run through a trial similar to what we would use to test medication. So I think that one of the things that's important is that in a world of waiting lists, there's things that you can do now. Yep. So online treatment is accessible at the moment, it's private, it reduces the stigma in terms of accessing treatment. You're able to do it at your own time, in your own place at home. We know the courses are effective. St Vincent's quickly, as I said, realised that there would be an increase in demand, and thanks to some philanthropic funding, we were able to offer the courses for free during the initial part of the pandemic, and there was a massive increase in demand of about 600% across the community. Which represents tens of thousands of people that have been working through these courses.
Thank you so much. And I would encourage all of our corporate partners to reach out to me if you would like to organise This Way Up for your organisations. It's currently a benefit of our partnership, and it's really, really beneficial. There are even some mindfulness courses on there if you want to start light.
So we have our wellbeing courses around mindfulness, insomnia and coping with stress. They're a little bit shorter. They're still very heavily based on what we call cognitive behavioural therapy. And then, of course, we have the disorder-specific courses. One of the things that I've seen in this pandemic, and I'm sure you've seen the same thing, is people actually don't know what the hell they're feeling and whether what the hell they're feeling is normal. So on our website, we've got a series of questionnaires and that you're able to do, and as part of that, we'll give recommendations about what we think is helpful. So it may be one of the wellbeing courses, it may be one of the transdiagnostic courses, or one of the disorder-specific courses. So have a look.
Great. So I've got a smaller version now of the laptop in front of me. So would anyone like to ask Matthew or Michael, Shantini or myself a question at the moment? You're welcome to raise your hand with the little icon on Zoom, or just give me a wave, and then you can unmute yourself. I can see some people talking. Sandra, did you want to ask a question? Oh, you've got the book in front of you. I think you'll just need to unmute yourself, Sandra.
The quote of 2020.
There we go. The quote of 2020, absolutely. Have we got some volume coming for Sandra?
Can you hear me okay?
Sorry, Sandra.
That's okay. Can you hear me now?
Yes, we've got you now. Perfect.
Yeah, I saw that, the quote of 2020 is your look, thank you for the book. It looks amazing. I don't have a question, but it reminded me of how we kick off our meetings in the People and Culture here at Sunrise. We always start our meeting with talking about something positive that has happened in our day. So it just resonated with me in terms of how you communicate with kids in terms of school. But it's really worked well in our team because it does allow you to focus on the positive. It does allow you to stop and think, what's happened today? And weirdly enough, if we can't think of something positive, because sometimes you've just got out of bed and come into the office and somebody's saying what's positive that's happened in your day. Well, apart from the fact that I'm alive and breathing, it makes you think about something funny that's happened to you. It might be a little funny story, so it's just a nice way to kick it off. And we've been doing that for about a year now.
Oh, fantastic. Well, it's really great to hear that you're implementing these positive ways to start your day, because it does have an impact. And it actually has been shown to increase productivity. So well done to you. Bravo to you.
Thank you.
Is there anyone else who'd like to raise their hand or add something? Don't be shy. Oh, we seem to have gone to a different view now, but that's okay.
That would have been more distressing, that for you.
Well, I think at this stage, I'll hand it back to Shantini just to say her thanks and wrap up the session.
Actually, I have a burning question, and that is, Stephanie, is your backdrop the COVID-19 testing clinic at Bondi?
Correct.
Oh, brilliant.
That's excellent. I've been looking at it the whole time going, I think it's our testing clinic at Bondi. So once again, thanks so much to All Shelter for your help with that. And thank you so much, Mike and Matthew, for your contribution, as always, for everything that you both do, for the foundation and our supporters, and of course our patients and our community, Mike. One of the things I did want to reflect on is that Mike and Matthew have both said, I think being in Sydney, being in New South Wales, we have been fortunate, not just in the way our healthcare system has been able to respond and, touch wood, to this date, help to manage the spread of the virus. But it really has demonstrated the importance of having a very robust and resilient hospital and healthcare system. And the support of the community through this time has just been incredible for our hospitals. It does also give us the opportunity, I think, when we know that there are these problems that have arisen as a result of the bushfires, as a result of the pandemic, for the mental health of our community. We are also in the fortunate position to start thinking about the most strategic, long-term solutions that can help the spectrum of issues that our community is facing and is going to be facing. And here at St Vincent's, we have a mental health strategic plan that looks at how we can do that across the spectrum. So be that prevention, and we've talked about a little bit about that here, how important that is, the education, the support before it becomes a major issue is crucial to preventing hospitalisation, to obviously preventing suicide. At St Vincent's, we're looking at setting up, for example, a safe haven cafe, a drop-in centre where people can receive support, education, resources within the community and close by our campus, so that that support can be provided by clinicians. We are very close to setting up a managed alcohol program, which is quite innovative and leading edge to address alcoholism for people who are really struggling. And we're also identified a partner and looking to set up a new prevention and recovery centre. So we've got some quite key projects which speak to the heart of that value of compassion, which Mike mentioned today and Matthew also mentioned. And compassion is a value of St Vincent's that is very important in responding to the mental health needs of the community. And so we're very focused on trying to address these issues strategically and, hope to continue the tremendous support we've had philanthropically to help our hospitals to achieve those goals. So I hope you've enjoyed our session today. Obviously, there's some great resources, particularly the This Way Up program, which is available to our corporate partners for all your staff, and just let Ashley know.
Absolutely.
And thank you for your time. We will be having more of these in-conversation sessions, so we would really appreciate your feedback on this first one. Just email Ashley.
Thank you so much, Anthony. I would love to hear from all of you. And I just want to echo my thanks as well to Dr. Mike Millard and Matthew Duncan for your support and for lending us your time. I personally found it incredibly valuable, and I've learned a lot about how to, keep my spirits up through all of this. So I hope you have too. So we will see you again next time. Thank you so much. Oh, look, we're getting some applause.
Bye.
Thank you. Bye, everyone.
Hope to see you in real life next time.
Yes, real life would be great.